Diabetes mellitus, sugar diabetes. We have two commonly used tests now, glucose and the hemoglobin A1C. Glucose is well known to you. Pricking the finger, seeing what the blood glucose is a certain time of day, or many times of the day, for brittle diabetics. The hemoglobin A1C has the advantage of it's measuring the glucose molecule covalently bound to a hemoglobin molecule, and that takes about 6 to 12 weeks to form. So it tells you what the glucose level is over a period of 6 to 12 weeks. That's almost what, 3 months? It can tell you how well your diet's working. You don't have to be fasting for this one. And the level is so reflective of how well you metabolize glucose that it's used as a diagnostic tool now, in addition to a monitoring tool. Thanks to the American Diabetic Association and the research that was done to shore that up. So we've got two diagnostic tools here for diabetes mellitus. Now, what happens if you control glucose? If you have really tight control, there's good data now, it wasn't always that way, but it is now, that you decrease the amount of eye disease, the diabetic retinopathy, by 78%. You decrease the nerve disease, the so-called diabetic neuropathy, the sharp pains, shooting pains that the diabetics have. You can decrease that by 60%. Add 5 more years to the life of a severe diabetic. That's not bad. And you do it what? With a blood test that costs a couple of bucks. But it means people have to be monitored. They have to be monitored, they have to be disciplined to do something about it, and see a doc who can oversee that. CDC said, although chronic diseases are among the most common and costly health problems, they are also among the most preventable. Diabetes is a killer. Blindness, kidney failure, heart disease. If you've ever had a family member that succumbed to diabetes mellitus, it's not a pretty sight. Managing diabetes can cost you $1,852 a year. What happens if you don't control it? Peripheral vascular disease, below-the-knee amputations, coronaries, strokes, and dialysis.